Hello, my name is Dr. Newt Maney. Welcome to the IS Academy Clear Smile Brace webinar on anterior alignment orthodontics for general dental practitioners. The IS Academy offers a complete pathway from simple to comprehensive orthodontics for general dental practitioners, starting from simple removable appliances which offer anterior alignment orthodontics up to a 12-month teaching course on comprehensive orthodontics. The IAS Academy's teaching faculty consists of specialist orthodontists and highly experienced general dentists from around the world. In recent years, there's been a significant increase in the elective adult orthodontic claims experienced by the dental indemnity companies. General dental practitioners carrying out orthodontics without specialist training account for most of these claims. Non-specialists hit far more problems in relation to case assessments, underestimating the complexity and risks of treatment, not referring appropriately, and not recognizing when they are in trouble. So what goes wrong with these cases? Tends to be dissatisfaction with the outcome of the treatment, which is normally the aesthetics. Collateral damage such as things like extractions or inappropriate interproximal reduction or slicing of the teeth. Relapse post-treatment, not referring when appropriate, dissatisfaction with the treatment time that the case has taken, especially when the patient may have been promised a treatment time which may have only been just a few months. Where does it go wrong? The vast bulk of cases falls down to the poor diagnosis, poor case assessment, and not creating an appropriate treatment plan. Communication and consent, where the dentist has not relayed to the patient what the potential pitfalls of the treatment are, or what the outcome of the treatment could be, and what aspects of the malocclusion they may not be able to resolve. If we look at the actual chart here, you see that the actual treatment does not comprise the major component of where the errors occur. It actually falls down fundamentally to the diagnosis and assessment and the communication of the treatment plan to the patient. One can often presume that dental claims in relation to orthodontic treatment can be quite minor, but in actual reality, many claims can actually reach a five-figure settlement. So you can see why the dental protection organizations and the General Dental Council are exhibiting some concerns over the GDP orthodontic market. It's because of these increasing medico-legal issues that our IS training director, Professor Ross Hobson, who is a consultant specialist orthodontist, has put together the IS Training Academy's philosophy, which is correct assessment, correct diagnosis, appropriate treatment planning, delivering appropriate treatment. In fact, Professor Ross Hobson has been quoted as saying that the right person should be doing the right thing at the right time because patient safety is paramount. Small braces training is not a course. Continuum of education with full case mentoring, continual support, and following an accreditation pathway which can lead on to further orthodontic training. The course is the very first step. Over the last decade, there has been a phenomenal increase in the number of patients who have been seeking to improve their smiles with cosmetic dentistry. In fact, in a 2012 Mintel Dental Survey, they estimate that there will be a 21% growth in the cosmetic dental sector in the next 5 years, where patients are continuing seeking straighter, whiter teeth. What has been driving this market is obviously the media and in particular celebrities. The example here is Cheryl Cole, who notably had her smile significantly improved with a combination of some orthodontics and some veneers. And in fact, when she had her smile improved, in the year that she was voted Celebrity of the Year, when she went to collect her award, she actually thanked her dentist for her new smile, which obviously raised the profile of cosmetic dentistry and the dentist in being able to help people improve their smiles. Another survey is by the British Orthodontic Society, which was a YouGov poll in 2010. It showed that 45% of the UK adult population are unhappy with their smile. And if you think about that, that's a significant number of millions of adult patients. And 20% of those would even consider wearing traditional metal braces. So that one can therefore perceive that there's quite a substantial potential market for the future. In fact, if you look around your own clinics, or if you look on the population that you may come across on the tubes, or at your place of work, or when you go shopping, there are many, many patients out there who have maybe crowding or spacing or general asymmetry of their smile. Now, a lot of those patients may be happy with their smiles today, but there's a growing number of patients whose perceptions about their general being is changing, and over time, those patients are beginning to seek correction or improvement of their smiles. In fact, Jonathan is one of those patients. He came to my clinic asking to improve his smile, which we did using the Clear Smile Brace appliance. Now, the reason why adult patients are beginning to accept fixed appliances on their teeth is because of like the Aesthetic Plus bracket, which we use with the Clear Smile Brace appliances, which are crystal clear, comfortable, low profile ceramic brackets, and they are combined with tooth colored wires, making them far more discreet and far more socially acceptable for many adult patients. So if we have a case here like Diane, she was able to improve her smile within a short period of time, which is about 4 months, by aligning her anterior teeth. In fact, when she started her treatment, she hated her smile so much, and the terminology hate is a very powerful bit of language there. And you imagine the psychology of a patient to actually physically hate a smile, obviously will have a big psychological bearing. So as soon as we're able to align her smile and give her the look that she desired, her confidence and the way she felt about herself completely changed. And then her post treatment quote was, "I love my straight teeth." Another example here is Jane, who in the period of 5 months with Clear Smile Brace, we were able to smile and give her that confidence where she started off with a quote saying, "I avoid smiling in my pictures," which, if you imagine how we'd perceive someone who basically didn't smile, who shied away from the camera, tried to not smile in public, may put a hand in front of her mouth because of a lack of confidence. That all has an effect on the way we perceive someone, the way someone can express themselves. So, being able to transform someone using the Clear Smile Brace appliance in a few months is quite remarkable. And the lovely quote that she gave afterwards is, "I just can't stop smiling." Another great example was Andre, who in the period of 5 months, we transformed him from his quote, which was, "My girlfriend hates my front tooth," which was his upper right one. And by literally placing the compliance, we're able to truthfully smile. And he was nicely quoted us afterwards as saying, "Now getting married." Now, as you can see, smile, not not every patient's looking for the perfect Hollywood smile. In fact, most patients are just looking for improvement. They're just looking for balance. They're looking for natural smiles, but they want symmetry and aesthetics. If you have a patient who currently comes to your chair wanting to improve their smile, what options do you have? First option is to refer them for traditional orthodontics. Now, in my experience, many patients where that is can be the desirable treatment option tend to decline traditional orthodontics because it tends to be a treatment plan which is too protracted for them. The other option that sometimes patients seek is a placement of a restorative solution, which can be involve crowns, veneers, bridges, and potentially extraction of teeth, and in certain cases, soft tissue and bone surgery. So a case like this, which in this picture, if we're trying to restore them restoratively, would be very difficult to do and would be quite aggressive in terms of dentistry would have to deliver. So most patients who don't want to have elaborate comprehensive orthodontics or don't want to have their teeth substantially prepared or extensive dentistry done restoratively are faced traditionally with no treatment option. However, there is an option that is available which we call anterior alignment orthodontics. So what is anterior alignment orthodontics? It is a leveling and aligning of the anterior teeth using aesthetic orthodontic appliances to improve the smile. If you notice, we did not use the terminology of time here. You may have heard references with other orthodontic companies of the term short-term orthodontics. With ClearSmile Brace, we divorce ourselves from the terminology of time because our aim is to get the best aesthetic outcome for that patient, and most of our treatment will be lower in treatment time compared to traditional orthodontics because we're not having a comprehensive approach to the complete malocclusion, but only focusing on the anterior teeth, which takes less time to resolve. And as you can see from here, I think that's a good option for patients where the alternative would be far more aggressive, such as in this case, which involved the substantial preparation of the teeth for veneers and crowns. And one does have to remind ourselves of the old test, which is called the daughter's test, which is if that was your daughter, would you prepare your daughter's teeth in the same fashion if the majority of those teeth were actually, as in this case, virgin teeth? Bearing in mind the long-term biomechanical issues which those teeth will face because they've been irreversibly damaged by the preparation of crowns and veneers. In fact, today, the contemporary approach to cosmetic dentistry and smile makeover dentistry is by using a more minimally invasive approach, and it's termed ABB, which is align, bleach, bonding, and recontouring, which is a three-step smile to a smile makeover. So if we look at this particular example here, where a patient has come in seeking a straight white smile, that can be achieved just by aligning the anterior teeth, correcting any tooth wear or tooth shape anomalies with cosmetic bonding, and carrying out simultaneously some tooth whitening. We touched on a little bit earlier, why do most adult patients decline traditional comprehensive orthodontics? Number one is the appearance, because they do not consider it socially appropriate for them, especially if they're adult patients, to have metal brackets placed on their teeth, especially as you can see here from America Ferrera from the Ugly Betty TV series, where the concept of her ugliness was perpetuated by the placement of these metal brackets. The other area where patients are concerned about having orthodontics is about the protracted treatment times, where they can run from a year and a half to up to 3 years, which for many adult patients does not fit in with their work or social schedules. So why do patients tend to say yes to appliances like ClearSmile braces? It's because we're using clear brackets, aesthetic clear brackets with aesthetic tooth-colored wires, making the braces far more discreet and far more socially acceptable. And also because we're focusing on the anterior teeth only, the treatment times are going to be substantially lower, ranging between 4 to 12 months, which for many adult patients is pretty acceptable. Aligning the anterior teeth only on an adult patient can have a substantial change to the way that the patient feels about themselves and about the way they look. And this is well recorded by research, such as the study by Gazelle and Rapport, which is on the psychosocial reward of orthodontic treatment in adult patients. One must not underestimate the improvement in self esteem and the benefits you can have for a lot of patients by offering this sort of treatment. So, where do you stand medico legally as a general practitioner offering this style of orthodontics? With any indemnity company, as a general dentist, you're able to offer any treatment which is within your skill base. So, provided you have appropriate training, you can offer any treatment such as endodontics, periodontics, implantology, orthodontics, provided you have the skill set to deliver that treatment. And if the treatment is beyond your capability, you must refer to an appropriate colleague. So, what is the difference between comprehensive orthodontics and anterior alignment orthodontics? The goals with comprehensive orthodontics are different. The aim is to develop a class 1 dental relationship, which means a class 1 incisor relationship with normal